Okay. Well, welcome to this recording. Um, Shanice, will you introduce yourself, a little bit about yourself and then what you do?
Right. So I'm Shanice Gabriel. I'm a pelvic health or women's health physiotherapist at Movement 101. So I'm currently working in Sydney, currently at Woolleye Creek, but I will be moving across to the North Shore Clinic. So at Movement 101, we have 7 clinics across Sydney. We've got women's health physios at most of them. And I'll just be at the Cremorne and Neutral Bay Clinic. So women's health physio, what we actually do is specialise in women's health, in the women's body. So especially around the pelvis, around the muscles that attach to the pelvis and the pelvic floor. So that's what we'll be talking about a lot today on kind of like our role and how we can help you have the best lifestyle and have the best outcomes for your pelvic floor.
Yeah, that's really great. I feel like I lived in Europe and then I lived in the US when I had my first child and then had my second child in Sydney. And I wouldn't say that women's health physios are a specialty in the US yet. I think it's long overdue. But can you just dive a little deeper into why pelvic floor health is so important for us as we go through life?
Mm. So the pelvic floor, just to give a little bit of a recap on like what it actually is. So this is the pelvis. This is specifically the women's pelvis. So you can see you've got your lower back that comes down and touches onto your 2 pelvic bones. And then you've got a bone at the front here called your pubic bone as well. Down here, we have the first layer of our pelvic floor. So this is what we call our superficial pelvic floor. So this is one we can see from the outside. So obviously it's covered by skin and hair. But when we do a pelvic floor assessment, we can actually like separate through the muscles, separate through the labia and see these muscles working. So 2 major roles of these muscles, they need to be able to contract to keep control of your urine, your bowels, and your wind, but they also need to be able to fully relax to keep to allow you to fully empty your bladder, fully empty your bowel, allow you to have comfortable intercourse, and also to birth a baby as well. We know obviously with childbirth there can be changes to this muscle, such as tearing through this muscle here called your perineum. Inside your pelvis, you've got your 3 pelvic organs that sit there. So I don't know if you can see inside here. The bladder sits at the front. This is where the urine is stored and it comes out of the urethra. You've got your uterus and your fallopian tubes here. So that's where your periods come from. And if you do fall pregnant, that's where you fall pregnant and your baby grows. That entrance comes down towards the vagina there. And then at the back, you've got your rectum and that comes out to your anus here. But if you actually take these organs out, you'll see there's a second layer of your pelvic floor. So this is our deep pelvic floor layer. So whether you have a vaginal birth, cesarean birth, whether you have any babies at all, you can get changes to this layer of your pelvic floor. So the major role of this muscle is upward support of your pelvic organs. So as you actually go through life, your pelvic floor can change to whether, just like any other muscle, can become weak, but it can also become too tight and overactive as well. So it's really important that over your life stage that you get to know the different changes in pelvic floor symptoms, so you can look out for that, flag that, and go and see a health professional as you need as well.
Yeah, I like that you touched on both the strength and the sort of softness that we need in the pelvic floor. I personally, coming from more of an exercise background, I assumed when I had my own child that if my pelvic floor was super strong, that was great. And it was really good during my pregnancy. And then post-pregnancy, it got too strong and I started leaking. And then I spoke to a physical therapist about it. And she said the same thing. You have to be able to actually fully relax it and you need to find like a middle ground. So it's also, thank you for showing that to us anatomically, because there's a lot of really funny memes and videos online about how little we all know about the anatomy of the body in that region and the different areas of what comes out where. And I think it's good to have a little refresher and also know that there's the 2 layers. So within those 2 layers, so there are people who will be watching this and listening to this who will have birth babies and people who won't. What are sort of the things you see more with the first versus the latter?
So in people that have had a child and have had delivered vaginally, we know that 1 in 5 of those people will end up with some degree of prolapse. So prolapse is a decreased support of the pelvic organs. So in them, they might get feelings of heaviness, bulging, fullness in the vagina region. Sometimes they can feel this like dragging or pulling sensation in their lower abdomen, or like they can get really bad back pain as well. In those ladies as well, 1 in 3 will end up with some degree of incontinence as well. So there's a few different types of incontinence. You can get stress incontinence, which is leaking when there's a raised intra-abdominal pressure, like a cough, sneeze, laugh, jump, run. You can also get urge incontinence, where you get leaking associated with a difficult to sense, like strong sensation to urine. So I'm standing in the supermarket and my bladder tells me I need to go and I leak on the way to the toilet. You can also get a mix of those as well, which they call mixed urinary incontinence. You can also, on the other hand, get fecal incontinence, and that can be flatus, so wind, so inability to control your wind, or even leaking of the bowel matter as well. So you can get those symptoms. But that being said, some people that have never given birth before can also have these changes, because we know there's obviously impacts with hormones, incorrect loading of the pelvic floor, trauma as well. So whether there's a fall or an accident or any sexual trauma as well. In any population as well, what I'm seeing a lot more of in clinical practice is also the pelvic pain side of things. So endometriosis, PCOS, sexual trauma, and vaginismus are something that definitely is getting more awareness and education around in terms of women coming forward, which I think is amazing. And there's a lot of people that have been living with pelvic pain for a significant amount of years. And to know that in Australia, 1 in 8, and probably even more because it's very undiagnosed, women have endometriosis, which can cause significant pelvic pain in terms of, discomfort around the vulva, around the vagina, or even around the abdomen and lower back, because these pelvic muscles are too tight. So in the population, in terms of like birth or people that have never had babies, you can see a whole variety of things. So I think it's really great to build awareness of what women's health physios can actually treat and see, because I think even when I started in my profession, I was like really naive, being like, okay, it's all just going to be weakness and incontinence, and it's just ladies like after birth, like having leaking. But the more we dive in, the more like complex cases we see. It's a mix of different things and lots of different presentations that can occur, whether you have a child or whether you don't.
Would you say, so looking at the male body, how much pelvic floor dysfunction or symptoms or pain can there be? Do you have any insights in that?
With male, yes. So there actually are men's health physios as well. So not as many across Sydney because it is quite a specialised area. But there are definitely dysfunctions that can occur in the male pelvic floor. So men can leak too, whether it's fecal matter or urine as well. We're seeing a lot more men leaking post prostatectomy, so post prostate removal surgery. Also, obviously, men can have significant pelvic pain as well. So with that comes like testicular pain, perineal pain, penile pain as well. And then obviously in the men's health realm, we've also got things like erectile dysfunction, Peyronie's disease, which are where the muscles of the pelvic floor don't function coordinately or properly as well. So there's definitely that element to pelvic health generally as well.
Yeah, that's really interesting. I think it's there are obviously there's medicine for erectile dysfunction, for example, and there's been a lot of funding that's been poured into it. I'm waiting for some of like a fraction of that funding to go more into like women's health and especially pelvic floor issues and data sets, all these conditions like endometriosis and PCOS, to see how women can be helped better. So now that you've shared a few of the symptoms, when you do an assessment with someone, obviously it's a very intimate region. It might be difficult. Sometimes I find that when we describe our symptoms to caregivers or practitioners, there's a very subjective air to it. And sometimes it's even that we're trying to play it down. So a lot of women in particular can really live with quite high pain thresholds and play it down because they don't have the time, they don't want to go, and maybe insurance doesn't cover it. That's probably more of an issue here. Or it's like, well, it happens to everyone. Like we spoke about this briefly, that a lot of people assume that if you have birthed a baby, especially vaginally, that then a certain level of incontinence is just normal. When you assess someone, what does that look like?
So for our clinic, we spend a significant amount of time in our assessments, because I find the more you kind of ask questions, the more people are like, oh, I never thought of that. But there's so many different pieces of the puzzle that can play together to give you a correct diagnosis. So we spend a long time just going through like timeline and subjective history, go, okay, what actually has happened? So you're leaking now, but what's happened like the last 5 years? Is it because you've birthed a baby? Is it because you've had a slip or a fall and you've fallen on your tailbone? Is it different elements? Have you started a new sport? Things like that. So kind of gives us ideas of, is it actually a pelvic floor weakness, or is it that your pelvic floor is too overactive? Is it because you've got urethral hypermobility, all these different elements? And then we'll actually go into if the patient is comfortable in an objective assessment. So that can look different for everybody. So we've got at our clinic, and I know a lot of women's health and men's health physios have real-time ultrasounds machines. So it's an ultrasound that shows muscles in real time. So we can actually pop it on the lower abdomen, look at the pelvic floor, actually along the length of the perineum. So popping the probe here, and it gives us a great picture of what's actually going on inside. Obviously, we know that's only part, can tell us a little bit. The most accurate diagnosis for us is actually doing an internal assessment. So assessing these outer layer muscles and then going into the vagina and then assessing what's actually happening to the pelvic organs, what happens to the pelvic floor when I ask you to bear down and push, what happens to the pelvic floor when I ask you to contract quickly, does it actually come up or is it very slow? So it's a lot of things obviously we can feel tactilely that you can't see visually as well. So that's what we will do as part of the assessment. And then from there, it's talking to the client or the patient about what they actually want to achieve, what they want to get out of it, how can we improve their quality of life, and then giving them treatment plans and strategies to improve that.
Yeah.
And that's going to look different for everyone.
Yeah. Yeah, I'm really keen. We said that in the second half of this, we'll go through 1 or 2 exercises that objectively people could do and benefit from. In the interim, it's, I've had one of these internal pelvic floor exams done, and I thought it was really fascinating. There's a lot to cues. I think that I was lucky that I had both from my obstetrician when I delivered my first child, in terms of, like you said, how to bear down to like birth a baby and do that slow enough also to not have a tear. My obstetrician knew that I had an athletic past, and so she mentioned to me that she had had a mother, these are my children, a mother who had given birth to a child in 2 pushes. And then she saw my face, because I took that as a challenge. And as and she saw my husband's face. Like, no, don't. No. And then she quickly added that woman had a 4th-degree tear because she was so strong, and because she had no one, like, it was too quick for the doctor to even step in and say, no, wait, hold on. So I think the first thing that comes to mind when people think of recovery, whether it's before or after a child, is Kegels. Can you just talk us through what Kegels are again as a refresher, and then the usefulness of doing them sort of just throughout the day? Would you just like do a Kegel and release and do a Kegel and release? Is that useful?
Yeah, so traditionally everyone has, like, post-birth or during pregnancy, have done these exercises. And basically what it is a pelvic floor squeeze. Yeah. And there always comes a question to Kegel or not to. And I think it comes down to what we're actually finding during your assessment. So what they actually showed with research is if someone's actually given a verbal cue on how to turn on their pelvic floor. So say if I say, okay, do a pelvic floor squeeze, only 1 in 3 people will do it actually correctly. So that's like, can they actually do it? Are they lifting or are they actually pushing down? Can they, are they actually just gripping their bottom muscles? Are they doing a proper squeeze? Can they do it with their breath? So I think it's really important to, if you do want to do pelvic floor exercises, and I think there definitely is an element of importance there, that you're making sure that you do it correctly. Because a lot of people will come into my clinic and they're like, no, I've been leaking for a year. I do my pelvic floor exercises all the day. I actually had one lady that says she used to do 100 a day. She came in here and she was doing it completely incorrectly. I'm like, no wonder your symptoms are getting worse and you're not getting any better. So I think it's really important that you get the assessment. Just like if you were an avid gym goer or anything like that, you would have someone look at your squat technique, or you'd have someone make sure that you're doing the right program. I think that's really important, because just with any other muscle in the human body, the pelvic floor, there's different elements of muscle contraction. So we need it to activate correctly, but we need it to be coordinated. We need it to have good endurance. So there's all those different elements of it as well. Like, we need to make sure you contract, but also can let go. So the only way we're going to know that you can actually do it correctly is if we assess it. So I'd encourage anyone, like, during your pregnancy journey. So in Australia, we normally do it from 20 weeks. You can come and get an internal pelvic floor check just to make sure that pelvic floor exercises are appropriate for you as well. Because if you've had a history of chronic constipation, we know that you might not be doing your exercises correctly, because we know on the toilet, if you're chronically constipated, instead of your pelvic floor letting go and releasing so your stool can come out, what it normally does is contract. So those type of patients we normally find are the ones doing pelvic floor exercises incorrectly, or if you've had a history of pelvic pain, sexual trauma, endometriosis, you might be on that tighter side. So I think it's really important to make sure that it is an efficient and effective contraction if you are doing it.
Okay. Well, so then last question before I'll ask you to maybe just talk us through. I'm going to pop down on a mat. Maybe you can show me an exercise and just tell us a few cues for whether it's for Kegels or another exercise that you might think is better. Jade eggs or any other things that people insert to hold them. What are your thoughts?
That's a really good question. So there's so many things that you can look at. So there's like, it almost looks like a little tampon. You can put little weights in it and you can insert it. What they've shown with research is that those little weights are no more as effective than just doing your pelvic floor exercises. So with my patients, I always will give them the treatment options and go, okay, do you want to lie down and do your pelvic exercises for like this many sets, this many rounds, or would you rather put this in and walk around the house with it while you're doing the laundry or something like that? So it all depends on people's lifestyle and efficiency. So yes, they definitely do work, but they're no more as effective than just doing your general strengthening or your body strengthening as well.
Okay, yeah, that's interesting. Yeah, because I had one of those. And there was definitely the ease of it and the sort of, set it and forget it. But then, some people seem really adamantly against them. And then obviously it's also hard for people to distinguish what is marketing, what really works. So, but it was an interesting thing that I got from a mom of 2 or 3 kids after I had my first child. And I just thought, well, she probably knows what she's talking about. Like she's been there before me.
Yeah, and I think it all comes down to what the individual's lifestyle is and what their goals are, because everyone needs different pelvic floor strengths. And I think if you're an elite athlete, you're a CrossFitter, you do like high intensity interval training, your baseline need for your pelvic floor strength is going to be a lot more than just someone who wants to be able to walk or do Pilates or just more gentler activities. So I think it's important to know that not everyone needs to achieve 5 out of 5 pelvic floor strength, because most people that come through my clinic about a 3 out of 5, so we grade it on a muscle scale, and they're totally fine. They'll never have pelvic floor dysfunction, so or they don't have symptoms, they're just getting checked. So it's important to know that yes, there you can use those sort of things if that's your goal, but for the majority of people they probably don't need it. So
okay, yeah, no, that's good. I have so many more questions, but I think for this one we're going to keep it short. I'm going to take the computer, pop it down on the floor, and then we can pretend that you want to give me an exercise that I could do at home to just, maintain a healthy pelvic floor. Obviously not someone who's like has a severe injury or symptoms, but what's like a good practice for people?
So everyone responds to different cues, but a really great cue to use. So if you actually lie down onto your back, so with your knees bent, so we call that crook lying. This is one of the easiest positions to actually feel your pelvic floor activate. So it's normally where I'll start most people. If people struggle in this position, side lying is another good one that they can practice in. When you're in sitting and standing, what actually happens is you already get a co-activation, like an automatic contraction of your pelvic floor. So being able to do it in standing and sitting is a lot harder, and you'll tend to overgrip like your inner thighs, your abdominal wall, your glutes as well. So this is a really great way to practice. So what you can do is actually lying down onto your back. You can just place your fingers inside just your hip bones here. Yeah. And that's where you can start to feel a pelvic floor contraction, because the pelvic floor is part of your deep core. So it's connected to your diaphragm, it's connected to your transverse abdominis at the front and your multifidus at the back. So just having your fingers inside those little 2 hip bones here, what you'll feel is as you do a pelvic floor squeeze is just a gentle contraction of your transverse abdominis come on as well. So what I say to people is find your neutral spine. Yeah. And then what you're going to do is you're going to, so you just kind of relax your back a little bit, relax your rib cage down into the mat. You breathe in. On your exhale, you want to squeeze and lift your pelvic floor. So we think about stop the wind, stop the wave. And then you breathe in, relax back down. You breathe out, activate, stop the wind, stop the wave. And then you relax back again on your breath in. The reason we think stop the wind, stop the wave is we're thinking about what those muscles actually look like from our anatomy. So obviously we've got the muscles around your urethra, but then also around that anal passage as well. So a lot of people will just go stop the wee, but you're actually forgetting about all these ones around the anus as well. So it's important to go breathe out, squeeze, breathe in, relax, let go.
And so on your side, if you lie like this, and you have your hand inside your hip bone, so you breathe in, you relax everything. And
then you breathe
and go. Okay, it's obviously hard to go.
Yeah. So when we do pelvic floor squeeze, we want to make sure it's not grip, like everything turns on as well. So you want to try to keep your abdominal wall, so like your six-pack muscle, like your superficial one, quite relaxed as well, because we want to actually make sure those deeper muscles are working. So it's all about just trying to, you know, just gentle. And that's what sometimes I have to pull people back on how much they're actually doing it just to get a proper contraction as well. And that's something really great we can see when we do the ultrasound as well, because you can watch all the different muscle layers and you can either see if they all turn on together or you can just get an isolated contraction as well.
Yeah. Yeah, I would imagine also, so I've done some work with people for the adverse transverse abdominis, and all people just contract their abs, their superficial abs, right? Like the intensity, you could see it like right here, and there wasn't much happening in the deep core, but the cue was really good. So again, like I think a lot of people equate inhaling with like contracting, right? And you had the exact so with the inhale, we relax everything. It's almost like everything down, and then we try not to over engage these muscles when we exhale.
That's correct.
We can feel that here because I hadn't actually thought of it here. So inhaling.
And then exhale, pelvic floor goes on. Should feel like a little bit of a push through your fingers there with that muscle coming out without it being too hard. So it just should be a gentle contraction under your fingertips there. And you will feel like obviously a tightening around your urethra and also around your anal passage as well. Okay. Yeah. But that's how you can make sure that you're doing it properly, because a lot of people just can't feel what's happening around their pelvic floor, but that's how you can know it's turning on as well.
And then what would be one step above that if people do that well, or what's an alternative? So let's say the pelvic floor symptoms are connected to like lower back pain, and it's not actually to do so much with birthing or, you know, like anything at the front, but it's really just presenting as back pain, but you've now assessed that it's probably coming from this connection and that intricate web of your pelvic floor.
Yeah, so normally when it's connected to back pain, I often find that the pelvic floor is a little bit, obviously, could be on that tighter side. And what they've shown with research is all this cool new stuff coming out about yin yoga and pelvic floor hypertonicity and pelvic floor overactivity. So with those people, it's normally a lot of down training and diaphragmatic breathing. So it's getting them into these pelvic opening stretches and getting them to do deep breathing. Because remember that pelvic floor and diaphragm are related. So when we actually get the deep breathing, the pelvic floor is forced to relax a little bit. So with those people, I normally give them 3 really simple stretches. So like a butterfly stretch. So you lie on your back, feet together. And you just open those knees out. Yeah, so normally go hands on the belly, you just focus on your deep breathing, you can close your eyes, put your music on, but I just want you to focus on like slow inhale, slow exhale, and just picturing that pelvic floor in your mind and just relaxing it as much as you can. So we're not bearing down and pushing, but we're just letting go of any tension that might be there. So that's a really good one that I use. The other one I use is a happy baby. So it's when you grab the inside, of your ankles, and then you open your legs out. Yeah, it's a really nice one to do. Obviously, that one can be a little bit hard to hold. So with yin yoga, you normally hold your stretches for long periods of time, for like 2 to 3 minutes each pose. It's just a great way to, like, obviously to let go of that pelvic floor, open it up, relax it as well. Yeah. And then the other one I give people is a child's pose stretch. That's obviously on your knees, reaching your hands forward, knees super wide as well.
So knees super wide for this one.
Yeah, big toes together, knees wide. Yeah, just to open up through that pelvis again. So that's obviously for people that are on that tighter side of the pelvic floor. Yeah. For people that are having issues with weakness, it's all about when do they actually feel it. So for a lot of my people that come in, it's normally with that stress incontinence, so that raised intra-abdominal pressure. So if they cough, sneeze, or laugh, they get a leak. So with those people, rather than just like lying down onto their like back and doing like squeeze, let go, squeeze, let go. Yes, it's going to help in somewhat to get that activation, but their issue is actually coordination. So I'd get them doing like quick squeezes, getting that reaction time, but also a technique called the knack. So if they actually leak when they sneeze, getting them to pre-activate. So squeeze and lift, sneeze, relax, let go. So you're getting that brain muscle connection again. Squeeze and lift, brace, big sneeze, let go, relax. And then also, like, if people were having leaking with running, making sure that their glutes are super strong, making sure their adductors are strong. So when they're actually running, the load isn't coming straight up onto their blood and making them leak. So looking at what's their running technique like, do they actually have the strength around those areas, and getting them actually to practice things like, you know, little like skaters side to side in a controlled environment where they're working on their landing technique and making it more specific to them. So there was another research paper that came out that, you know, used a vaginal probe, put it up into like obviously the vaginal canal, and watched what happened to the pelvic floor as people loaded it. So did like little like, you know, hops, little squat jumps, and it's actually a pre-activation of the pelvic floor. So for a lot of my patients, once they have that strength, I actually get them to start doing things like they're jogging, they're running, their high knees in a controlled environment, because that little exposure will start to get that coordination building up again. So definitely it's all related to what we find in that subjective history, what's actually causing you your symptoms, when did it start, all those sort of things, so we can actually work out what the best line of treatment is. So yes, pelvic floor, isolated pelvic floor muscle training does have some element, but will only give you so much.
Yeah. I think I've done a lot of work with people on changing their movement patterns, you know, for like functional training, especially after injury. And I like that you said that. So I just have one more last question, which is, as we get older, and then, you know, we deal with muscle loss, we deal with reduced bone mineral density. How, like, when we look at people in terms of longevity, I think, you know, our bodies start deteriorating sooner, but we're also leading longer lives now. What are sort of your observations and recommendations for people to stay on top of that? Are you a fan of prehab? Are you
I'm like the earlier you can start getting into good habits, I think the better. So getting the best team surrounding you, so get like a great doctor, like GP, general practitioner, get a great trainer like that can design a really great exercise program for you to keep you at a healthy weight, keep your muscles strong. I think if you can start getting those habits in early, it's going to make life a lot easier. So yes, the pelvic floor, there's always going to be like weakness that does come, but if we can start to bringing like good habits early, that's going to prevent obviously muscle deterioration, but also reducing the amount of pressure that's down on the pelvic floor. So like healthy weight is such a big thing. Making sure that your eating's right to avoid things like constipation, because as soon as you start getting constipated, you're straining down on your pelvic floor. So there's all these little elements that come into play as well. So yes, keeping your pelvic floor strong is important, but having that healthy lifestyle and like the best health practitioners around you, I think is probably the more important thing.
Yeah, I really like that. And just outside of the pelvic floor, what are the other areas that you see in older women? Like, you know, like injuries. I could tell you what I've been seeing, but maybe like, let's just hear it from you. You know, what are the joints, the pain points that women should start being aware of, maybe as early as their early 30s, that there could be problems that arise that have actually nothing to do with their reproductive area?
Yeah, bone health, I think that's important. So keeping your joints healthy. So resistance exercise, weight bearing, loading exercises are so important. So making sure that you've got that element into your like just a general program as well, because I'll find people that come in with like hip pain, back pain, and they're, you know, osteopenic at a very early age. So we know osteopenic has that element that can be reversed, and you can start to lay down new bone. So I think it's really important that we start early, like making sure that we're loading our joints correctly. And then I just see quite a lot of overuse injuries, so tendon injuries, so a lot of like rotator cuff, shoulder injuries as well, plantar fasciitis, knee tendons, all that sort of stuff as well. So just making sure that if you are exercising and loading your body, you're doing it in a healthy, productive and safe way as well.
Okay. Thank you. I feel like I want to dive into every one of those injuries specifically, you know, in a different chat. But let me just end this recording and say thank you so much. Is there anything you'd like to mention about your practice, your work, like for people to find you online?
Yeah, what I'll do is I'll send my details, or you can put them on the video as well, like my email address. Anyone can email me at any point. That comes directly to me. So send across any questions, or if you found anything super interesting or you want to chat to me further, I'm happy to have a chat. If you're around Sydney, happy to come and see, happy to treat you and assess you at my clinics as well, or anyone across my team can help as well. But thank you so much for having me. I think it's so important, and it's so great that we can get the message out there about female health and female bodies, and that it's just not reserved just for people that have had babies. It's people along any of that part, any of the female part of the lifespan as well. So it's great. Thank you so much for having me.